Welcome to a brand new deep dive. We all carry these powerful mini computers in our pockets, constantly upgrading. But how often do we really think about the intricate battles happening under the surface? It's way beyond just a new design or better camera. Today, we're peeling back the layers on your smartphone. We're looking at two fascinating yet kind of interconnected aspects of its evolution. That's the constant uphill battle for power and the groundbreaking potential of these devices as personal health tools.
Yeah, and our source material for this deep dive is pretty interesting. We've got a February 2024 report from Terius Research focusing on battery tech and smartphone innovation. And alongside that, we're looking at a really detailed review from PubMed Central. That one covers smartphone sensors for health monitoring and even diagnosis. So our mission today is to unpack these challenges facing smartphone power. They're pretty formidable, and also the immense potential for personal health, plus the complex regulatory landscape that's trying to keep us safe.
Okay, so what does this all really mean for you? And, the device that's probably in your hand, or at least nearby right now. Let's unpack this. Let's start with something I think we all feel, that frustration with battery life. Have you noticed your phone just barely making it through the day sometimes, even on a full charge? It feels like we're always looking for an outlet.
It really does. And what's fascinating here is how several pressures are sort of converging to create that exact struggle. You've got the demand for more and more performance from the system on chip, the SULA, that's basically the phone's brain, plus better memory, more advanced cameras.
Yeah.
It's all pushing the hardware to its absolute limits.
Right. And it's not just the components themselves, is it? It's how we actually use the phones. We're seeing this permanent shift in habits globally.
Yeah.
Things like constant video streaming, immersive social media, and especially the huge rise of artificial intelligence, AI.
Exactly. Really demanding tasks like AI Copilot features, where the AI helps you write or give suggestions. And things like content creation, those advanced photo filters, accessibility tools, they're all just eating power faster than any improvements in efficiency can really offset. The Terius research source actually highlights that generative AI, Gen AI, is expected to push workloads so hard that getting even 8 hours of battery life on a smartphone could become, well, a real challenge soon.
Wow, 8 hours. So wait, even as our phones get smarter, more capable, their physical growth, like the screen sizes actually hit a wall, that seems counterintuitive. What's the implication there?
Yeah, the really critical point. Battery technology itself just hasn't kept pace. The report points out that battery capacity growth has mainly come from just making the device bigger, which in turn was usually driven by needing a bigger display. But look at the data from 2019 to 2023. Screen sizes basically plateaued right around 6.5 inches. So that means battery technology, the core chemistry, hasn't changed much in the smartphone era. And that leads to these constrained designs. It slows down any real innovation in capacity growth.
So it sounds like we're kind of stuck in a dilemma. Physics is holding us back almost. We want these super smartphones, powerful AI features, but the power source, the battery, isn't evolving nearly as fast. The report even talks about this unfair fight, doesn't it, between the phone's chip and multiple cloud GPUs.
That's precisely the challenge. Even the most efficient large language models, the LLMs, designed for phones, the ones on flagship devices like the iPhone 15 Pro Max or the Galaxy S23 Ultra, they still significantly underperform compared to the big cloud versions, speed-wise anyway.
How much slower are we talking?
Well, for example, running a model like Llama 2, even a smaller 7 billion parameter version on those phones, you're often looking at speeds like maybe 4.7 up to 15.5 tokens per second. Compare that to ChatGPT 4 in the cloud, which averages around 13 to 15 tokens per second, typically.
So it's noticeable.
Definitely. It really underscores the difficulty of running that kind of complex AI locally on the device itself.
And when you look at specific apps, the data paints a pretty clear picture, right? That power consumption table you mentioned. It shows adding AI, even in hybrid apps, it just drains the battery faster.
Absolutely. Interactive video, especially with AI enhancements like, say, upscaling video to 8K, that absolutely kills battery life. Just look at 8K video at 60 frames per second. It uses way more capacity per hour than standard 4K video.
It really makes you think, doesn't it? Is chasing that better camera quality, the AI video stuff, worth constantly being tethered to a charger? Feels like there's always a compromise.
That's a great observation. And it raises the big question, okay, what's the solution then? The report does point to a few paths forward. Things like optimization techniques, quantization, and pruning.
What do those mean exactly?
They essentially shrink and streamline the AI models, make them more efficient so they can run better on less powerful hardware, like your phone. And they're also hybrid computing models. The idea is the phone handles simpler tasks locally, but offloads the really complex stuff to the cloud.
Okay, so moving more computing to the edge, right onto the device itself, that has big benefits, right? Like lower data center costs, faster response times, maybe better privacy and security.
Huge benefits, yeah, definitely.
But is it realistic? Can we expect these tiny devices to handle all that complex AI locally, given what we just said about power limits? Or is the cloud still going to be the main engine for the heavy lifting?
That's the real tension we're navigating right now. Edge computing has immense promise, absolutely. But those power demands are still significant. So we're likely going to see a blend, probably for the foreseeable future. Your phone will get smarter about deciding what to process itself and what to send off to the cloud. It's a constant balancing act. Performance, power, privacy.
Okay, so we've dug into this constant struggle with battery life, especially with AI demanding more and more. But here's where things get really exciting, potentially transformative. What if these same devices, despite their power challenges, are also changing something as fundamental as our personal health?
Right. And the driving force here is, well, it's a critical societal need, actually. We're seeing this dramatic rise in life expectancy globally. That means a rapidly growing elderly population. You couple that with the spread of chronic diseases, cardiovascular conditions, diabetes, respiratory illnesses, and of course, the constantly increasing costs of healthcare services. There's just this urgent demand for healthcare solutions that are affordable, non-invasive, and importantly, easy to use.
And the smartphone, it's everywhere. It has sensors built in, communication tech. It seems perfectly positioned to fill that gap.
Perfectly positioned, exactly. And to really appreciate this, it helps to look back a bit at the smartphone's journey. Did you know the concept goes back to 1992, the IBM Simon?
Really? 92?
Yeah, combined a phone and a PDA, had a touchscreen, could handle emails, faxes. It was revolutionary. But it cost like $899 back then. Way too expensive for most people.
Wow, okay, so it wasn't an overnight thing.
Not at all. Then you had the Nokia 9000 communicator in '96. Ericsson actually coined the term smartphone for its GS88, though that one never actually got released. Too heavy, battery issues. Sound familiar?
Yeah, some things don't change.
Right. It was Ericsson again in 2000 that officially used the term for the R380. Smaller, cheaper, introduced the Symbian OS. Early camera phones popped up around then too, from Samsung and Sharp. But it wasn't really until Sanjo's SCP-5300 in 2002 that we saw a phone with a built-in camera, web browsing, and email all together.
That's fascinating. So that long evolution really set the stage for the health tools we're seeing now.
Absolutely. It laid the groundwork, turning this general-purpose communication device into potentially a powerful health monitor.
Okay, so the potential sounds huge, but what are the most impactful ways our phones are being used for health today? What capabilities might actually surprise people listening?
Well, the list is pretty extensive now, and yeah, some are surprising. Your phone can monitor cardiovascular activity, things like heart rate variability. How? Using the camera, or sometimes the microphone.
The camera, how does that work?
Well, we'll get into specifics, but basically detecting subtle changes. It can also assess eye health, respiratory and lung health, skin health, mostly using the image sensor. Then for daily activity, fall detection, it uses the motion sensors, accelerometer, gyroscope, and GPS. It can even monitor sleep patterns, assist with cognitive function, mental health. It's quite broad.
Okay, can you give us some specific examples? How does it work on the device itself, like the heart rate thing with the camera?
Certainly. So for heart rate, there are contact methods. You put your fingertip over the camera lens, the flash illuminates the tissue, and the camera detects tiny changes in color as blood pumps through.
Yeah.
But there are also contactless systems, like one example called FaceBeat from way back in 2012, actually. It extracts your heart rate just from a video of your face using the front camera.
Just from video?
Yeah, it looks for those really subtle changes in skin color caused by blood flow. And it was pretty accurate. Maximum average error was just 1.5% compared to a proper medical ECG.
That's incredible. But I guess doing those complex calculations.
Exactly. Increases processor load, significantly impacts battery life.
Yeah.
Brings us right back to our first point, doesn't it?
It really does. A perfect connection. Okay, what about eye health or skin health? How do those work without, specialized medical gear?
Good question. For eye health, diagnosing something like diabetic retinopathy needs high-quality images of the retina. And modern smartphone cameras actually meet the resolution requirements. Now, you need at least 50 pixels per degree, imagers over 124 by 768, which they have. Early techniques needed clip-on lenses or pen lights, but newer innovations just use the phone's built-in flashlight as the light source for retinal imaging. For skin health, just taking a normal picture often isn't enough for complex lesions. But there are techniques using spectral imaging, sometimes using a special ring light with polarizers that attaches to the phone camera. It analyzes how different wavelengths of light reflect off the skin to map out things called chromophores.
Chromophore.
Yeah, they're the natural color pigments in your body, like hemoglobin in blood or melanin in skin. Analyzing those can help differentiate between different skin conditions or diseases.
Wow, that's sophisticated stuff from just a phone camera. And what about the everyday monitoring? Tracking activity, detecting falls, that seems maybe more straightforward.
It uses different sensors, yeah. That's where the accelerometers, gyroscopes, magnetometers come in. The motion sensors. They're embedded in your phone already, and they can be highly accurate for recognizing activities, walking, sitting, running, even detecting if someone falls down. Some studies report accuracies up to 99% for daily activity recognition using machine learning algorithms analyzing that sensor data.
Okay, it sounds like our phones are becoming these powerful new eyes and ears for our health, almost like a personal health dashboard. But with such incredible capability, there's got to be an equally incredible responsibility, right? If my phone is suddenly acting like a diagnostic tool, who's making sure it's not just powerful, but also safe and actually accurate?
You've absolutely hit on the crucial point. Many experts have raised really serious concerns about the accuracy and reliability of these apps, particularly because, well, the vast majority reportedly lack enough involvement from actual medical professionals during their design and testing. There was one stark example, a dermatology app called SkinScan. A study found it correctly recognized only about 10.8% of high-risk melanomas.
Only 10%. That's worrying.
Very worrying. Some apps have even been reported as potentially unsafe, possibly causing life-threatening consequences if people rely on them incorrectly.
Okay, but is that SkinScan app just a bad apple, an outlier? Or does it point to a wider systemic problem across all health apps? Are there areas where phone-based monitoring is actually proving reliable?
It's definitely a spectrum. Some apps are problematic, no doubt, but the underlying technology can be reliable for certain things, especially applications using those motion sensors we talked about, or simple data logging tools. The risk is much higher when you get into apps claiming to diagnose or guide treatment. And that is precisely why regulation is so vital. In the U.S., it's the FDA, the Food and Drug Administration. They regulate mobile medical apps that essentially turn your smartphone into a medical device like an ophthalmoscope app or dermatoscope app, or apps that act as an accessory to an already FDA-approved device, like a smartphone-based ECG monitor that works with specific hardware.
And what do they require for approval?
They require clinical trials or other strong evidence, especially for higher-risk devices. Although there is some controversy around approving devices based on so-called predicate devices, basically, showing similarity to a product already on the market. Some argue that can compromise safety and discourage new clinical trials.
Okay, and how does Europe handle this? Is it similar?
In Europe, the key thing is the CE mark. Under the older EU Medical Device Directive, most smartphone health apps were considered medical devices and needed that CE certification. That mark confirms the product meets basic health, safety, and environmental protection standards. But a really important change came with the new EU Medical Device Regulation, the MDR, which took full effect in May 2020.
What changed with the MDR?
It significantly broadens the definition of medical devices. Now it includes even some non-medical and cosmetic devices if they function similarly. And crucially, it places a much stronger emphasis on clinical data and actual evidence of effectiveness.
So what are the key differences then between the U.S. approach with the FDA and the EU approach? Sounds like maybe different philosophies.
You're right, there are some distinctions. A primary one is that the FDA in the U.S. explicitly requires devices to demonstrate not just safety and performance, but also clinical efficacy. Does it actually work medically?
Okay.
In contrast, the CE mark in Europe, especially under the older rules, mainly confirmed compliance with safety and performance standards. Clinical effectiveness wasn't always as rigorously proven, though the new MDR is definitely pushing more in that direction. Another difference is structure. The U.S. has one main regulatory body, the FDA. Getting approval can be a lengthy process. In the EU, manufacturers can often choose between multiple private organizations called notified bodies to do the assessment. That can sometimes speed up approval, but it has also drawn criticism for potentially leading to varying standards between those bodies.
And for us, the users, it sounds like it can be really confusing, almost like navigating a new country without a map, right? There are so many apps, they all promise health benefits, but figuring out which ones are genuinely safe, reliable, medically sound, it's tough. and maybe even risky.
Absolutely. The lines between a simple fitness or wellness app and a genuine medical app are still pretty blurry, ambiguous. And that can be really problematic, especially if data from a basic, unvalidated fitness app somehow gets integrated into actual patient care.
Yeah, I can see that being an issue.
Definitely. This whole situation has led to widespread calls for something like a centralized database or maybe a dedicated app store just for properly approved, validated medical apps. Imagine a system that could review and recommend apps based on clear criteria: quality, reliability, medical effectiveness, safety, privacy, even value for money. That would be a huge benefit for everyone, consumers trying to make informed choices, and even developers who are doing things the right way.
Okay, so we've taken quite a journey here. We've dived deep into the incredible demands on our smartphone batteries, the amazing, almost science fiction potential of these devices as health monitoring tools, and then this complex web of regulations that's struggling to keep pace with how fast everything is changing.
Yeah, the future of your smartphone really involves this dynamic tension, doesn't it? You've got this insatiable demand for more processing power, more AI features, constantly bumping up against the very real limits of today's battery technology. And at the exact same time, these devices are becoming indispensable tools for personal health management. But that comes with huge challenges in regulatory oversight, ensuring they're actually safe and effective.
It really makes you stop and think about how quickly our relationship with these devices is evolving, doesn't it? They're just not phones anymore. They're personal assistants, they're health monitors, they're powerful computing hubs we carry everywhere.
Which really raises a crucial question for all of us moving forward. As our phones become ever more central to our health, our daily lives, and as AI keeps pushing the boundaries of what's possible, how will that delicate balance between innovation, regulation, and our own personal privacy continue to evolve? What personal health insights will you be willing to trust to that device in your pocket? And maybe, what responsibilities do we all share in demanding robust standards for these new digital health guardians?